Please review this video for instructions regarding your pet's care in the postoperative period. When you arrive at the hospital to pick your pet up from surgery, a technician can address any questions that you may have regarding these instructions. Your discharge technician will also discuss any medications that your pet needs to take and when and how to administer them.
Your pet may be sent home with several medications following their surgery. Your pet's surgeon will determine a pain management plan appropriate to your pet's specific surgery. Please complete all medication courses as directed on your pet's discharge instructions. Do not stop any medications without consulting a member of your surgery team. If you are concerned your pet may be experiencing side effects of a particular medication, please call to discuss with a member of your surgery team. Surgeries create pain and inflammation. Pain medications are important to help manage discomfort and to reduce inflammation at the surgery site. Pain charts can be useful in determining if your pet is painful, but pets can be good at hiding their pain. Therefore, your pet's pain medication must be continued as directed on your discharge instructions. We will now discuss how to use one of these two pain scales to determine if your pet is painful following their surgery.
For cats, their ears will be facing forward, eyes opened, muzzle relaxed, whiskers will look loose and curved, and their head will be above the shoulder line if they're comfortable and feeling good. For cats that are starting to get painful, their ears will be slightly pulled apart, eyes partially opened, their muzzle may be mildly tense, their whiskers might be slightly curved or straight, and their head will start to droop and be aligned down with their shoulder line. For cats that are more painful, their ears will typically be flattened and rotated outwards, their eyes will be squinted, their muzzle will be tense, their whiskers will be straight and moving forward, and their head will be bowed down a little bit below the shoulder line or tilted down. Other signs of pain in cats can include hiding behaviors or refusal to eat. To determine if your dog is painful, you want to look at their body language. Your dog should be comfortable when resting, look happy and content, and not bothering their surgical site. If your dog is becoming painful, they may look unsettled, restless, they may appear uncomfortable when resting, they may groan, whimper, or cry, or lick the surgical site. Their ears may start to droop, or they may develop a worried facial expression. They can also develop reluctance to respond or move when you beckon them, and they're less eager to interact with you. Another good way to determine if your pet is painful for either a cat or a dog is to pet them along their back and then gradually work your hand down towards their incision and gently touch the area. And if your pet flinches away, whimpers, or cries, that might be an indication that they're feeling some pain at the surgical site. If you feel that your pet is not well managed by the pain medication that we've provided following their surgery, please reach out to us and we'll develop a plan to keep your pet comfortable. Please do not administer anything over the counter to your pet as far as pain medications go. Human pain medications can be quite toxic to pets. Please feed your pet half of their normal dinner after 6 p.m. tonight. We recommend this smaller feeding the night following surgery to prevent any regurgitation or vomiting. Normal portion sizes may be resumed tomorrow morning. Please offer a small amount of water when you get home, and then make sure that they do have a bowl of water down later in the evening, and they should always have access to fresh water.
If your pet's doctor is recommending any calorie adjustments following your pet's procedure, they will be outlined on your written discharge instructions. Constipation can be commonly seen following anesthesia. To prevent this from occurring in your pet, Miralax or plain canned pumpkin can be administered. Please choose to administer Miralax or pumpkin, not both unless otherwise directed. Please ensure that if you choose pumpkin, that it is the plain canned pumpkin, not the pumpkin pie filling. Please review your discharge instructions for your pet's dose, or review the following charts for dosing. The charts list a pet's weight in pounds on the leftmost column, and the dose for pumpkin or Miralax in the right column. This dose should be repeated twice daily. Please start one of these options if no bowel movement is observed within a day or so following surgery. If your pet displays vomiting, diarrhea, anorexia, or straining to defecate without producing a bowel movement, please call our hospital. Your pet must be restricted from exercising and confined indoors for 2 weeks. This includes preventing running, jumping, and rough play, and keeping your pet from furniture and beds. When outside, your pet must be kept on a short, non-retractable leash so that you can prevent excessive activity and should only be taken on short walks for elimination. When inside, if your pet's activity cannot be kept restricted on one level, then your pet's activity should be limited to a smaller area. Please utilize baby gates or a crate to do so. Failure to follow exercise restriction guidelines can result in surgical complications. If your pet is very active typically and you think you may have trouble adhering to these instructions, please let your doctor and surgical team know so we can develop a plan to ensure that you are successful.
Please keep your pet separated from other pets in the home when they cannot be supervised. This is to prevent rough playing between pets and also to prevent other pets in the home from licking your pet's surgical incision.
Your cat must be restricted from exercising and confined indoors for 2 weeks. This includes preventing running, jumping, and rough play, and keeping your pet from furniture and beds. Please confine your cat to a smaller area. Your cat should be shut into one room where they can be restricted from jumping and climbing. Alternatively, a large dog crate can be used. The crate can house your cat's food, water, litter, and bedding. Please do not allow resting in the litter box. If you notice the litter sticking to your cat's incision, consider changing the litter to a crystal litter, yesterday's news, or a shredded paper litter. Please clean the litter daily and closely observe your pet's waste for any abnormalities. Failure to follow exercise restriction guidelines can result in surgical complications. If your pet is very active typically and you think you may have trouble adhering to these instructions, please let your doctor and the surgical team know so we can develop a plan to ensure that you are successful.
Please keep your pet separated from other pets in the home when they cannot be supervised. This is to prevent rough playing between pets and also to prevent other pets in the home from licking your pet's surgical incision. Please monitor your pet's incision site at least twice daily following the surgical procedure. We'd like you to monitor for redness, bruising, swelling, discharge, sutures coming loose, or incision edges coming apart. If you notice any of these signs, please reach out to our hospital.
We recommend taking a photo of your pet's incision shortly after arriving home from the hospital. This will allow you to more easily monitor for changes in your pet's incision. Utilizing a cold compress following your pet's procedure is recommended. This helps to manage pain and inflammation at the surgery site. Please use any soft ice pack that you would use on yourself and apply it to the incision with a barrier layer. This barrier layer can consist of a clean towel or clean washcloth or a stack of paper towels. This layer is important to prevent any bacteria or moisture from getting into the incision. Please utilize the cold compress 3 times daily for 10 minutes at a time for at least 3 to 4 days following your pet's procedure. If fur or litter begins to stick to your pet's surgery site, intermittent, slightly damp but not wet, warm compresses can be applied to the area to soften the material. Then, tease the material off the surgery site with a cotton swab. If you are not comfortable performing this procedure, or if you are concerned about the incision, please call our hospital.
Please discourage your pet from licking, chewing, or scratching at the surgery site. Licking, chewing, or scratching of the surgical incision may result in trauma, dehiscence or opening up of the incision, or infection of the surgical site, prolonged healing or recovery period, or additional financial cost. A recovery wear item will be provided to avoid these complications and additional financial cost. The recovery wear must be worn at all times for 2 weeks or until your pet's suture or staple removal if applicable. There are several different options available for recovery wear. There are 2 different styles of e-collar and a recovery shirt. Which option is most appropriate for your pet will depend on your pet's temperament and the location of your pet's incision. There are 2 different options for e-collars. The first is a plastic e-collar, also known as a funnel or cone.
It is clear, can be wiped clean, and broken down for storage. The second is the calmer cone, which is a softer fabric cone. It is held together by Velcro, which is important to note as the noise of the Velcro may startle your pet when putting the cone on or taking it off. This collar can be washed in the washing machine and air dried. The recovery shirt is meant to be snug to cover the incision. It can be worn outside or in the litter box during elimination. We recommend checking the recovery shirt for urine and/or fecal material after each time your pet eliminates. If your pet has trouble keeping the shirt clean while eliminating, please undo the Velcro straps and fold the shirt up or remove the shirt prior to elimination. If the shirt becomes soiled, it may be washed in the machine but should be hung to dry to avoid shrinkage. If the onesie is being washed, an alternative option such as another onesie or cone should be used so your pet cannot reach their incision in the meantime. It is important to note that the inflatable or donut e-collars are usually not an effective method of preventing licking, chewing, or scratching of your pet's incision. Please do not use an inflatable or donut e-collar unless it has been discussed with and approved by your surgeon. The frequency of recheck appointments varies from case to case. Please review your pet's written discharge instructions to confirm when recheck appointments will be necessary for your pet's case. If your pet has a drain placed, we will typically see you back in 5 to 7 days to remove the drain. If your pet has a bandage placed, we will typically see you back in 5 to 7 days to remove and replace the bandage. Bandage changes will continue every 5 to 7 days until the bandage is no longer necessary, which is typically 2 to 3 weeks post-op. There is a charge associated with each bandage change. If your pet has non-absorbable sutures or staples placed, these will typically be left in place for 2 weeks before they are removed. They may be left in place for longer in some instances, so please review your pet's specific discharge instructions to know when they must be removed for your pet. If your pet has absorbable sutures placed, they typically do not require removal and can be broken down by the body with time. Your surgeon will contact you with any diagnostic results that were collected at the time of surgery. However, it does take 1 to 2 weeks to receive those results. This includes histopathology, culture, and urolith analysis results. Following your pet's surgery, there are some symptoms that we would like you to monitor for that we do not like to see in our recovering patients. These symptoms include vomiting or diarrhea, loss of appetite, refusal to drink water for more than 1 day, profound weakness or lethargy, no urine produced for 24 hours, pale or bluish gums, changes to breathing or difficulty breathing, or problems with the incision site. Please reach out to us if you notice any issues or call a veterinary emergency center, such as Cornell or Veterinary Medical Center. Cornell's number is 607-253-3060. Veterinary Medical Center's phone number is 315-446-7933. The next 2 sections of this video will discuss bandage care and drain management. If your pet is not going home with a bandage or drain, you may stop watching this video at this time.
If your pet is being sent home with a bandage, it will likely cover the incision area, and you may not be able to inspect the incision area as we discussed earlier in this video. Therefore, we would like you to inspect the bandage twice daily to monitor for any issues. We'd like you to monitor for the bandage slipping, if it becomes damaged or chewed, develops an odor, or becomes soiled or wet. If you are able to see the toes of your pet through the bandage, please check the toes twice a day. Swollen toes indicate poor blood circulation to the foot. If the toes are covered by the bandage, please monitor for swelling above the bandage. If you're noticing any issues with the bandage, please reach out to us and we will replace it for you. Do not alter or add to the bandage in any way or attempt to replace it. Placing a bandage improperly can cut off circulation to the limb and cause damage. When your pet goes outside with a bandage on, a plastic bag over the bottom of the bandage or a Medipaw boot should be utilized to prevent the bandage from becoming wet or getting dirt onto it. The plastic bag should be removed immediately once your pet returns inside. Any bag that is placed should not be secured with a rubber band.
Your pet's bandage will typically need to be replaced every 5 to 7 days, or sooner if the bandage becomes wet, soiled, or is slipping. The bandage changes will continue until your pet no longer needs a bandage placed. A Jackson-Pratt drain is a closed drainage system which uses applied suction to help prevent swelling at the surgery site. Your pet's drain will need to be emptied every 12 hours while it is in place. Please start this process by washing your hands and wearing gloves to keep the area sanitary. Then, pinch the tubing coming out of the top of the grenade. Remove the cap on the grenade and attach the provided syringe. Tip the grenade over so that the fluid may be collected into the syringe. Note the character and the quantity of fluid as you're drawing it into the syringe. Completely empty the grenade of all of its fluid and discard it. Once the grenade is empty, squeeze all of the air out of the grenade and reapply the cap. Then release the tubing. Please measure and estimate the quantity of fluid and the character of fluid each time that you remove it. You should see fluid move through the drain to the grenade. If the amount of fluid increases or if you notice swelling, please contact our hospital. Please also watch the following video for a demonstration of drain management.